maybe I turn back to the panel. Has this triggered some additional thoughts? Maybe some questions that you would like to raise in addition that came up? I see Bjarne already lifting his finger, so please.
Okay, I think actually this is a fascinating discussion. And as I mentioned in my presentation, I think there is still something quite unique out there in engaging the health sector. I like your example of the obesity crisis across Europe, which is now actually spreading to other parts of the world quite fast. Now, it was interesting for me because obesity was, in WHO terms, a non-communicable disease, the same way that the health impacts of air quality is calculated, or at least expressed. And I think there is some lessons to be learned in how, when working with non-communicable diseases with the health sector in the past, how they have worked. The framework, WHO framework convention on tobacco, the banning of marketing in that respect. There's lots of experience of marketing instruments out there. And voluntary policy instruments, which I will call them. Which I think could be fascinating to put to good use. Again, it was what I mentioned, I think when engaging the health sector, there's a powerful potential to get a message out there that is just slightly different and more impactful. And as Mark said, if we indeed connect it to a few other issues, rather than wanting to save the environment, just connect them to other issues, you have a quite powerful tool to change. I think one of the challenges we're going to have, and I agree with the people who talked about communication and awareness raising campaign, not only do you have to connect it to people, but you also have to give them an opportunity to change something, because otherwise it just becomes bored. It was very easy with other non-communicable diseases. You do restrictions on marketing to children, you prevent your children eating candy. In tobacco, you put up restrictions on marketing on tobacco and run tobacco campaigns on how bad this is for your health, and you can at least stop smoking. Now, I think in terms of air quality, we need to come up with a set of tangible changes that can make a difference, where people can make a difference, and that actually applies on all levels. It both applies to the individual, but it certainly also applies to the policymakers and the health sector. In the cities that I know, where I live in the Philippines, if you ask healthcare service providers to give information about why something is bad, you also need to give information about how you can avoid that bad thing. Because otherwise you'll just leave the healthcare provider with a sigh and saying, oops, okay, this is not good for me, but I'm not quite sure what I can do about it. Besides wearing a mask on bad days and not walk 6 o'clock in the morning. So I think on the solution side is really where we can operate, and I'll stop there.
Yeah, I think you make a really important point. It came to my mind as well when we heard you speak about the obesity and you go to the supermarket and you see calorific value. I mean, that's easier than, well, for transport probably, but since you're using your own car, we won't reach anybody in the car by putting out a sticker. It would be more on public transport. By doing this, you're saving that and that. So turning it around and do a positive messaging. And maybe we would really have to go sector by sector how we can turn it around, and maybe it's not suitable for all sectors actually, but it's really this involvement of the other sectors to make it very concrete in terms of actionable items. Carlos.
I'm just thinking, I think those points that Bjarne was making are very useful in the how do you engage with people who are poor and who don't have, limited, how do you change that? I think one is taking the pictures. Many people have a mobile phone. The other perhaps is linking to, if it is your children, what is the air pollution levels that you may be able to reduce around schools or around the areas that children walk to school, or how can you perhaps make an effort to change the urban environments in areas which are going to benefit certain groups of the population more than others. So how do you come up with, or how is it that people who already suffer from one disease can, what are the environments that they can be protected? So I think it requires some kind of putting yourselves in the shoes of, in the skin of some of those groups. And I think we'll only learn that by having that kind of engagement. But my sense, my gut feeling at least, is that it would be worthwhile, as you're saying, to go from that other perspective, because we are doing those other things. I mean, of course, a cost-benefit analysis is a great idea, and I think we should be doing more and more spaces. But I think what we're looking for is there other things that could tell us or could engage people in a community in a different way, picking them up from a different reasoning. And I think it requires that kind of thinking. And the poverty angle is quite important. We had a similar discussion with the Healthy Cities people. And for them, that is the driving element of much of the Healthy Cities movement, is how is it that you bring about and address those inequalities, and how is it that you can create opportunities for people who don't have them. So maybe that would require some reflection and perhaps thinking around how I see it as the crucial issue as well.
You're absolutely right. The point on the development issue, the sustainable development link, the broader link is well noted, how to tie it to poverty alleviation, access to basic services, again, I mean, so to tie it back to that. I saw a hand up by Lydia, and then we have a reaction from Arnico. Thank you.
This links, my comment links very much to Carla's last statement, which is how do we, in a way, how do we bring the issue of air pollution and health impact to people much closer to people? And I remember that in the fight against, to remove lead out of gasoline, one of the strategies done by NGOs was actually to take blood lead levels in children, to show them that the lead in your gasoline actually ends up in children, and that alarmed the parents, and actually caused countries like Indonesia, albeit a little bit late, to actually take action. And for air pollution, it's quite difficult to convey this kind of message. However, we are getting better at it. Through the apps, for example, in Beijing, some of the monitoring systems actually send out the air pollution concentration levels to your iPhone or to your Android phone. Imagine what personal monitors, portable personal monitors could do to communicate that within the space that you actually breathe, you know what is the quality of air. And we know that groups there are several in the world now trying to develop these personal particle monitors. Because of course our ambient air quality monitoring stations only cover a specific space, which may not necessarily be, the space where you are in. That's one. And also linking this to poverty, and linking it directly to the activities of people, exposure, because for air pollution, it's really the exposure that you have to the pollution. The time that you spend exposed to the high levels matters. So I remember a small project that we did in Hong Kong and in several Asian countries, where we actually had a small personal monitor device, and we worked with school children together with Hong Kong Polytechnic University and some Fred's Corpset Norway exchange participants. They would keep a diary, a travel, like a diary of what they did in the day, and that would link to what were the particle levels that were collected, the data collected in a small device that was attached to their backpack. And so at least you can see a direct link to your activity. So if the child walked to school, you'd see the exposure. If you took the bus, you'd see the exposure and you'd see the peaks. So I think there are many ways now with technology that we can actually bring the issue of health much closer to the people.
Thanks very much. I think between the apps and, I mean, all these ideas that are floating out there, I think creative juices are flowing, and I think we can come up with pretty cool ideas here. Arniko.
Glinda kind of said about half of what I was going to say already, which is that maybe we shouldn't only think about motivating parents by having them think about kids, but actually engage the kids more directly themselves, thinking about school curricula, cartoons, what are things that catch attention of kids, and maybe get them to think, maybe learn things even faster than parents in some cases.
That's been a very successful strategy in many areas. If I think about waste separation, in my home country, this really picked up quite nicely thanks to education of kids and kids going home, Mom, this is the wrong dustbin, sort of thing. So it's powerful.
The other thing that I think is this business of the source. Because to talk of air pollution is a bit dispersed, right? It's floating somewhere in the air, although you're breathing it. And to make clear linkages with the sources, I'm not sure to what extent people have used that, people who have been using cities, to what extent they have sort of identified the culprits, create outrage. I mean, that's something which is used around certain specific sources that may be particularly relevant and that's locally applied. So to what extent that people have used that or not? I don't know if you have any experience.
I would like to ask, actually, it is you show there's a benefit of the calculated result for the Bangladesh for ozone. My question is, what is the accuracy of the calculator? Whether the modeling that you use is really right, or there's some shift to the right or shift to the left. Actually, the modeling is how specific, how sensitive?
Harry, I hate to do this to you. Could you?
The uncertainties are not shown on these graphs, so they're pretty wide. The point is this is illustrating the kind of outputs that the model produces. The accuracies and uncertainties are a work in progress, and these we will be working on. But the main point is that you can quite easily run scenarios comparing one possible intervention measure with another one, and then see which one produces saves the most lives. So it's a good way of prioritizing action on different implementation options, but it's still work in progress, and we will do uncertainty on these as well.
And my other question is, how it is a fact that you know that the ischemic heart disease is the risk factors are the hypertension, the high cholesterol, the high glucose, and so many. How are you going to say that the air pollution actually give the effect to the death of the ischemic heart disease? Because you don't know whether that lady or that man is actually exposed to the air pollution, and she or he have this, what you call the premature death.
It's very similar to the way we do with tobacco or diet or physical activity. They all act together. When you're doing epidemiological studies, you're assessing these different risk factors in conjunction. So by comparing the groups, you're able to identify which factor affects and how much they affect the result. So we are doing this already with diet, physical activity, hypertension. You see, the studies already have the methods that disentangle one impact from the other, one risk from the other. The studies which have been done to identify the impact of air pollution on heart disease, on strokes, have used exactly the same methods. They're follow-up studies, cohort studies. They look at various risk factors, and in the analysis you adjust for the impact of each one of those risk factors to identify what's each one's contribution. So it's pretty standard epidemiology and is good quality epidemiology. So the studies have that identified these are very substantial, very large. 1.3 million people, one follow-up study, so these very large studies. And they include consideration of these other risk factors. Do you understand? You still though. It's the same thing that we do already for the multiple causes of non-communicable diseases. We just, in these new studies, we have also considered air pollution as one risk factor, whilst the previous ones, many have not considered the studies for heart disease.
Hi, Gary Hack, Stockholm Environment Institute. I just have a question or a clarification, because I'm a bit confused when you're talking about, I understand that you want to maybe measure pollution, measure the impact, assess the impact of pollution on health. Then you talk about connecting with the health sector. But I'm a bit confused when we talk about behavioral change, what you would like to do. For example, if you're saying someone who has asthma or heart disease not to do certain things, and they will get that advice from a health professional. Or, I guess the question is, as an individual, if you're talking about behavioral change, are you asking me to change my behavior to stop polluting, or to change my behavior to stop my exposure? And if that is the case, then how do you empower? But then you need to empower them to do that. So if you're saying to a person, you're being exposed to high levels of pollution, and you've got heart disease, the most important thing is to sustain behavioral change over a period of time. But it's still unclear to me how it all fits in together. I've got the little bit, but I'm not yet understanding the whole focus of what you really want to do. Okay.
Okay, thank you very much. Fair point. We've been diverging a little bit here and there in the discussion, and certainly if we talk about the example that we got of it being super dangerous for your health to walk in the morning with high levels of exposure, here we have a sort of an emergency message, and that's beware, don't expose yourself. But what we really want to get at is changing the root causes. So we would like to get behavioral changes to reduce emissions. And then what we need to measure is in how far these these changed behaviors, the reduction of the sources in the first place, have a positive benefit on your health again. So it's this feedback loop. So it's getting people to do certain things, and that's where it's getting, of course, an awful lot more expensive, expensive probably as well, but difficult to take the action and to be clear in terms of the messaging. Yes.
Well, I understand that this is very essentially about awareness raising in the population. There was no mentioning of the press, of the media. I think they are very important and they can help. And at present, conveying the issue of health due to air pollution to the people is not done very strong in the media. It's very weak. One should also have champions, singers and actors who bring the issue closer to the people. And there's an actor and a singer or several in every country who could do it and who is environmental interested. Thank you.
Okay, thanks very much. One more comment by Annie.
A very small response. One item I did not mention because we're just starting in Nepal is we signed a contract with the two most famous comedians to produce a film about garbage fires, especially people lighting garbage fires in the evening when the smoke hangs low over the city. But we're just starting, so I didn't want to bring that up earlier.
Okay, well, thank you very much. I think we've exhausted our time that we had available for this session, unless there is a pressing last comment that...
No, I think those insights are very useful, and I think when you're thinking of a change, how much is individual behavior, and of course, that's crucially important. At the same time, to only frame and articulate the possibilities and the actions on air pollution for somebody who's at a very high level and sits somewhere which is away from the people is also, I think, not the complete response in the way that, how is that we get social engagement in some of those issues? How is that we get transformation in society? How much does individual behavior or understanding of what the source is and what could be done to change? And how is that it can be amplified through media, mass media or social media? So I think my sense is that those comments are all very relevant, especially because we have to be aware of those things. What are the possibilities that we have to put in? It's not you to blame the victim, but actually talking about around what your children is experimenting and what options there would be, where does it come from, what options there would be, in a way that links to the individuals. And how is that they want to change their environment, or then what are the mechanisms that they have in a democratic society would be one way. But I do think that the mass media, the communication, the mobile phones, etc., is more or less available to everyone. So we're still formulating those thoughts, but I think those comments are indeed very helpful. I find that very good. And I thank you for I think there's one last comment still.
Okay, well, please go ahead.
Hi, I'm Anna Valmero. I'm helping cover the event for Clean Air Asia. One thing though, when I'm attending conferences, I usually look for buzzwords, and I was kind of looking for the option because sustainability, quality, it's always, well, it's in the theme and it's in the title, so it's always been mentioned. But I was looking for other buzzwords also in terms of engaging your stakeholders by providing them trust and also choice, because I think those two are big action words also when you want to involve people in changing and change their behavior. One conference I've attended on eco-mobility last year, they had a city in South Korea, Suwon, wherein they really implemented a change in terms of providing green transport choices for the people and let them experience it for 2 months before holding the conference, so that they had like a scoping baseline. They have a baseline study in terms of the experience of the people before the green transport, for example, the green choices such as walking and wider pedestrian lanes are available versus when it is available to them. And 1 year right now, I have been doing follow-ups with the group who did it. It's ICLEI. I think they have one person also here who spoke during the Livable Cities or another venue. And the people when I interviewed the people on ground there last year, they were mentioning that at first they do not like it because they are taking away our choice of transportation. But after a while, some of the people actually liked what happened because they can walk freely around the city, and some of the tourists actually loved the fact that they are able to enjoy more of the scenery of the wall, one of their highlight tourist spots there. And they were mentioning that they are not, the kids also who has to go to school early in the morning, they are kind of comfortable in terms of letting them play outside, because one coffee shop owner doesn't want his niece to go outside because the cars are fast and they may endanger the kids, of course. And of course, they also mentioned air quality, but it's kind of an afterthought for them. But they really liked the change in experience. So I think also bringing some experience into the conference, I mean, not only for the session, but also for the conference would be a good avenue, because it allows the local community to experience what the conference is about. I'm not sure if some locals were invited from Colombo, aside from the top officials who have to speak also. So I think it pays to include also the youth, the media. I'm a communications by profession. I'm in the communication sector by profession, and I think there's really a lot of data that I'm digesting right now, and it's really, really interesting. But maybe try to bring in the impact so that the people will trust and they will know the choices that they will have to take in terms of the conference.
Thank you very much. I won't attempt to summarize this rich debate, but you've given us a lot of food for thought, that's for sure. There are a few issues that are still out there. I was hoping to get a little more about the tool. How useful is it? Can it help in your city? But maybe we didn't have enough of the city representatives, so this is something we will do in the next step in further rounds of those discussions. We will further seek advice and insights from stakeholders. And you will certainly hear back from us in terms of how things are shaping up. If you're interested in being more closely engaged, please do let us know. We'd be happy to continue having an exchange and follow up with you. Maybe with that, we'll leave it. And thank you very, very much as well for your patience. We've been starting late and ending late. And I wish you a very nice evening. Thank you.